Whenever you take a pill for a headache, you just trust it's gonna work, right? Of course you do. But if you ever actually stop to think about the incredible, really complex journey that tiny pill is about to take through your body, well, today we're gonna follow that journey, step by step.
It seems so simple, doesn't it? You swallow a pill, you feel better. But behind that simple action is this fascinating story of biology and chemistry. It's like a carefully choreographed dance that happens inside you every single time.
Okay, so the first thing you have to get is that this isn't a passive process where the drug just goes in and does its thing. Nope, it is a dynamic interaction. Your body acts on the drug, and at the same time, the drug acts on your body. These two things happening at once, that's the foundation of pretty much all of pharmacology.
And we can break down this two-way street into two core concepts. On one side, you've got pharmacokinetics. You can think of that as drug movement, which is the story of the pill's journey through your body. And on the other side, pharmacodynamics, or drug power, which is the story of the pill's mission once it actually arrives at its destination. So let's explore both, and we're going to start with the journey.
So, let's dive into pharmacokinetics. This is all about how your body puts that drug through an intense obstacle course. This biological gauntlet, really, to process it, move it around, and eventually get rid of it.
And that gauntlet has 4 key stages. You can remember them with the acronym ADME. That's absorption, distribution, metabolism, and excretion. This is basically the entire life cycle of a drug inside you, from the moment it enters to the moment it leaves.
All right, first up, absorption. For a drug to work throughout your whole body, it's got to get out of your stomach or wherever it is and into your bloodstream. This is the entry point, and it's the first major hurdle it has to clear.
And how you take that drug completely changes this first step. A pill you swallow has a much slower, more variable absorption. But a drug that's given intravenously through an IV, well, that goes straight into the blood, bypassing all those barriers for an immediate 100% effect. It really changes the game.
So once the drug makes it into your circulation, it's time for distribution. Your bloodstream is like a superhighway, delivering the drug all over your body. The goal is to get it from this main highway to the specific local streets, the tissues and the cells, where it's actually needed.
But here's where it gets really interesting. For drugs you take orally, the blood from your gut goes straight to the liver. And this is step 3, metabolism. Your liver is the body's main processing plant, and it immediately starts breaking that drug down. This is what we call the first pass effect.
To really see why this matters, let's just use an example. Let's say you swallow a pill, and the dose is 100 milligrams.
So as that drug passes through the liver for the very first time, a chunk of it gets chemically changed and basically inactivated. And here's where it gets even more personal. Your own unique genetic makeup can determine how fast or slow your liver does this job. That's a huge reason why the same dose of a drug can affect 2 people very, very differently.
So after that first pass through the liver, your initial 100 milligram dose might be knocked down to just 70 milligrams of active drug that actually makes it into your general circulation to do its job.
This whole concept has a name. It's called bioavailability. It's the percentage of the drug you took that actually reaches your bloodstream. So in our example, the bioavailability is 70%. This is exactly why an oral dose of a drug is often much higher than an IV dose of the same exact medicine.
And finally, after the drug has been distributed and used, the body has to clean up shop. This is excretion, the last step of the journey. This is where the kidneys filter the drug and its byproducts out of the blood and into the urine to be removed for good. So that's the whole journey. That's what your body does to the drug. But what about the drug's mission? What does the drug do to your body? Well, that brings us to the other side of the street, pharmacodynamics, the story of drug power. To carry out their mission, most drugs need to interact with a very specific target. Now think of ourselves as having thousands of tiny molecular locks on their surface. These are called receptors. A drug is designed to be a very specific key that fits perfectly into one of those locks. But here's the twist. Not all keys do the same thing. Some keys are designed to fit the lock and turn it, kicking off a process inside the cell. Other keys, though, are designed to fit the lock but jam it up, preventing it from being opened by anything else, including your body's own natural keys.
And this brings us to the 2 main types of keys. An agonist is the key that turns the lock. It binds to the receptor and activates it, causing a biological response. An antagonist, on the other hand, is the key that blocks the lock. It binds to the receptor but does nothing. It just sits there, preventing the body's own stuff from working. So you see, we have these two separate stories: the body's effect on the drug, its journey, and the drug's effect on the body, its mission. And understanding both is absolutely critical, because sometimes these two paths can interfere with each other.
This brings us to a really important practical concept: drug interactions. When you take more than one medicine, their individual journeys and their individual missions can cross paths, and sometimes that can be in pretty dangerous ways.
These interactions really fall into two main camps. A pharmacodynamic interaction is when two drugs are competing for the same lock or receptor. But a pharmacokinetic interaction is when one drug messes with the ADME journey of another. For instance, a classic example: drinking grapefruit juice can block a key enzyme in your liver. If you take certain medications, that juice can stop the drug from being metabolized, causing its levels to build up in your body to dangerous levels. That's a real-world pharmacokinetic interaction.
This is exactly why prescribing medicine is such a careful science. A doctor has to weigh the good things a drug is supposed to do against all the potential bad things and interactions that can happen along its journey and at its final destination. It's a constant balancing act.
So, what we've really seen is that swallowing a pill is so much more than a simple act. It's the beginning of this intricate biological story, a delicate dance between the chemistry you just swallowed and the incredibly complex biology of your own body. From absorption to excretion, from a key finding its lock to the potential for colliding pathways, it is a truly remarkable process. So, the next time you reach for that pill, maybe you'll have a whole new appreciation for the incredible journey it's about to take.